I came here because I was trying to find an alternative to open heart surgery. The concept of having one's chest opened up and going on a heart-lung machine and all the rest of the potential complications didn't seem to be a very logical approach to me.
ECP is a treatment using the venous circulation and the arterial circulation in the legs to enhance cardiac circulation. And we do that by putting large blood pressure cuffs on the legs and the lower abdomen. And then we have a machine that triggers these pressures when the heart relaxes right after its contraction. In effect, we're pushing large amounts of blood from the legs through the heart, and it has been shown in a number of studies that that creates its own bypasses, creates new blood vessels around blocked arteries in the heart, and it does it by a couple of mechanisms, including physical force, and it also releases vasoactive peptides which help create new blood vessels. So that has been proven to be effective in both angina, in end-stage angina even, and it has also shown to be effective in heart failure, improving cardiac muscle contraction.
I've been suffering for a number of years of breathlessness, unable to go very far, maybe 50 yards and have to sit down. I encountered a cardiologist when I was at the hospital after having what I consider a severe stroke, complete loss of the right side. And they did a bunch of other tests and so on and so forth. And that ended up saying that we better do an angioplastic, which is basically putting a light wire through your large artery and checking all of your veins and arteries, well, your arteries primarily in the heart. And they're clogged. And I'm trying to avoid the open heart thing. If I can, fine. But this, to me, is a logical approach of trying to resolve the problem. Basically, it encourages the growth of new, not old, new, and increasing the size of the old, because your heart consists of large arteries, but a multitude of very small ones that you cannot see unless they're under a microscope. The increased blood flow to the heart, which is the second reading on a heart thing, the top one is your body, okay, pumping to the body, and the second one is pumping to the heart. The increasing of pressure to that basically encourages and in some respects forces the growth of arterial little tiny wee things to be enlarged and additional. So what'll happen is that instead of the main thing that's getting clogged up or is clogged up, it will be bypassed by these smaller ones, a whole bunch of them, a whole nest of them, okay? And then these will serve the heart. And the test of this will be a stress test. I've already felt a difference. I can do more things. The various projects around the house, I seem to be able to, instead of working for 5 minutes, sitting down for 10, I'm now working for half an hour, sitting down for 5, that kind of thing. So from that standpoint, I think what we're also talking about is quality of life in your latter years. Because as you can see, I'm not a young guy anymore. I have reached past 50, past 60. I'm into the 70s, so there you go.